Hi, my name is Kristen Souza, a licensed mental health counselor specializing in ADHD. And today we're going to talk about attention deficit hyperactivity disorder, or an ADHD overview. We'll go over the definition of ADHD. I'll help you recognize the 3 different types of ADHD. We'll go over some common symptoms, how an ADHD diagnosis is made, and how to cope with ADHD. First, what is ADHD? ADHD is a neurodevelopmental disorder affecting executive functioning. ADHD can impact your day-to-day functioning due to symptoms of inability to complete a task, time management, disorganization, etc. These symptoms can impact your academics, your work life, your romantic relationships, friendships, and your parenting. But ADHD can be treated with medication, therapy, and self-coping skills, and you can live a completely normal life with ADHD. Let's go over the types of ADHD. A lot of people don't know that there are 3 different types. The first type is ADHD with predominantly inattentive presentation. This is going to look like disorganization, difficulty completing tasks, time blindness, missing little details, tardiness, etc. The second type of ADHD is ADHD with predominantly hyperactive impulsive presentation. This is going to be fidgeting, excessive movement, impulsiveness, blurting out, interrupting people, etc. The third type of ADHD is ADHD with combined presentation. So you're going to see a little bit of both. So the inattentive symptoms and the hyperactive impulsive symptoms. Let's go over symptoms of ADHD. It's important to note that ADHD symptoms and signs are usually seen before the age of 12, and there's usually a diagnosis after the age of 5. And this is because a lot of the behaviors associated with ADHD are typical normal childhood development. And this is usually before the age of 4. So a lot of the impulsivity and hyperactive behaviors are completely normal when it comes to children and toddlers under the age of 4. So children with ADHD often display difficulties with persistence in the face of challenging tasks or staying engaged with things that they find boring, like sitting still and reading versus doing a really cool puzzle or playing a game. Excessive motor activity. So hyperactivity in young children might look like the inability to sit still and they're going 100 miles per hour, go, 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 go. Having difficulty thinking through the consequences. Again, this can be completely normal for children and toddlers under the age of 4. It's important to note that ADHD requires the presence of symptoms of inattentive, related to inattention, hyperactive, impulsive, or both. In isolation, any of these characteristics of the disorder can be observed through normal childhood development, like I mentioned. That's why a diagnosis is usually made after the age of 5. Signs of ADHD in adulthood. Older individuals who continue to meet criteria for ADHD tend to have more problems with adjustment, poor mental health comparison groups. These adults continue to have issues with impulsivity, which can lead to financial or legal problems. These individuals are more likely to switch jobs, get speeding tickets, etc. A lot of adults that have ADHD also have comorbid mental health disorders like anxiety and depression. Late ADHD diagnoses are not uncommon. Why? Because a lot of ADHD symptoms get missed in early childhood or explained as normal childhood behaviors in development. But as you enter adulthood, the impulsiveness and hyperactivity may start looking like this: sense of underachievement or low self-esteem, chronic procrastination, and tendency to work endlessly to catch up with that procrastination, trouble with follow-through, tendency to speak one's mind, difficulty with following proper procedure, a need for high stimulation or an intolerance for boring activities, low tolerance for frustration, sense of insecurity or worry, mood swings, and a tendency toward addictive behaviors. So how is ADHD diagnosed? First, a diagnosis in ADHD is super important because it will unlock treatment options for you. For children, an early diagnosis is really important because it can get you tools and resources at school that you might not have had before the diagnosis. Keep in mind that ADHD requires the presence of symptoms related to inattention, hyperactivity, impulsivity, or both. It's important to note that in isolation, any of these characteristics of the disorder can be observed through normal childhood development. In order to get an ADHD diagnosis, a qualified licensed medical professional will need to make the ADHD diagnosis. So a licensed psychologist, psychiatrist, or licensed therapist. The clinical diagnosis of ADHD is often made by assessing the patient's symptoms, severity of impairment, family history, and psychosocial stressors. Pediatric evaluations typically include an interview with the parent and caregivers and the patient, behavioral observations, and a review of school, medical, or neuropsychological testing. Treatment of ADHD. Treatment for ADHD falls into 2 buckets: therapy, and medication. Behavior therapy has been identified for the past 20 years to be a really effective treatment for ADHD. It focuses on behavioral modifications for the unwanted symptoms of ADHD. This will focus on procedures where parents and the therapist work together to help modify the behaviors of the children and decrease undesirable behaviors like noncompliance and disruptions. Medication is also another great option for ADHD. Stimulants are the most common, such as Adderall or Ritalin, but there are also non-stimulant medications like Strattera. They have been shown to improve ADHD symptoms in children and adults. Medication for both stimulants and non-stimulants will be prescribed and monitored by a psychiatrist. Aside from therapy and medication options, there are a lot of coping skills that you can implement in your day-to-day life to improve your ADHD symptoms. We do have a video on healthy living tips for ADHD, and we will tag it in the description below. Little things you can do for someone with ADHD at home are find strategies that work for you. So sticky notes, different apps on your phone, using a timer, using your calendar, different cleaning bins, and things like that can be really helpful for managing your ADHD. Final thoughts on ADHD. If you are a loved one or dealing with ADHD, you are not alone. You don't have to suffer through unwanted symptoms. There are coping strategies you can implement in your home. There's also treatment options such as therapy and medication that can help you improve your symptoms. If you or a loved one are struggling with ADHD, you don't have to do it alone. Talking to a therapist that specializes in ADHD can help you understand your symptoms better. We've linked some valuable resources in the description and comments to help you find a therapist, psychiatrist, and other useful resources. Check them out.